so in this presentation, we're going to be looking at some of the benefits of CNR, but also some of the concerns that might arise through catch, neuter, return programs. Some of the research that we've done around some of these issues and identification of problems, and then development of what we hope are useful tools that you can apply practically in your own programs. So we all know what catch, neuter, return is. It goes by a bunch of different names, but essentially what we're talking about is the surgical sterilization of male and female dogs and cats. And when it's properly planned, catch, neuter, return is an effective population control technique and a humane technique for improving dog welfare. And there are lots of different things that we can look at to measure the success of those programs in terms of things have already been outlined in terms of reducing dog numbers, looking at dog health parameters, looking at human-dog interactions. So if there are so many benefits, what are the problems that I'm here to talk about? And I always feel like I'm the negative, miserable person, but I do think it's really important, if we're serious about improving welfare, that we are also open to self-evaluation, self-reflection, and just a little bit of self-criticism as well. None of us are perfect, and we're all trying to improve the situation. So we've heard a lot about surveying and data collection, and we know that that can be challenging for some programs. If we don't have that information, it can be really difficult to demonstrate effectiveness within those programs. Dogs can experience injury and distress during capture and transport. If staff are not familiar with dog behavior, we can get inappropriate handling or overly aggressive handling potentially. There's the potential for injury or the transmission of infectious diseases during kenneling. Poor surgical preparation can result in injury and increase the risk of post-operative pain and infection. And poor anesthetic planning or monitoring can result in consciousness during surgery, which I'm sure we would all agree is not something that we want to be seeing. If we have a lack of aseptic technique, either in instrument or surgical preparation, that can increase our infection risk. And poor surgical technique can result in tissue damage, increasing the risk of pain and post-operative infection. Being a good surgeon is not just about being a fast surgeon or about doing a lot of dogs every day. There's a balance between that and individual patient welfare as well. Inadequate analgesia can result in long-term pain, and inadequate pre- and post-release monitoring can result in pain and injury after release as well. So, this is the bit that hopefully you might have some thoughts for me on. Just like you to look at the dog that you can see on your screen. How do you think that dog is feeling? Just shout out loudly. Anxious, good, great. Why? What behaviors is that dog showing that makes you think it's scared or it's anxious? The ears, what about them? The back, yeah, the ears are back. What else? Body posture, what about it? It's down, the tail's between the legs, yeah, it's kind of tucked into that corner. What else can you see? Paw lifting, yes, single paw lift. It's a really classic anxiety sign, single paw lift. Okay, good. Why does that matter? Why is it important to recognize that this dog is scared? What is the progression of behavior we could see in this dog? Yeah, we see this. We see that weight has shifted forward, the ears have come forward, you can see the teeth. This is now a dog that is potentially going to bite. If we can pick up those earlier indicators of fear, of anxiety, we can take steps to change what we're doing and potentially minimize that risk to our staff and also enhance that dog's experience as it goes through that program. Okay, we've already seen this, this picture, but this is obviously a dog that's being prepared for a castration surgery, and the skin has been shaved to remove the hair, and that has resulted in injury to that area. Why do you think this has happened? So, because of what, sorry? Blunt, yeah, so potentially a blunt razor, yep. Why else might it have happened? Lack of training, the guy doesn't know how to do it. Yeah, these are all common problems. Sometimes, and I've talked to people when I've seen this, sometimes people do it because they think you've got to remove all the hair and it's much better to be as close as possible. Whereas actually the evidence is that you're better off leaving a stubble layer and leaving the skin surface intact, because that dog is going to be painful, It's much more likely to lick and chew after the surgery because that skin is abraded and painful. You've got a much increased risk of post-operative infection, and because that skin surface is disrupted, there's much more likely that bacteria is going to invade into that area. So you're actually better off just doing less shaving and a bit more cleaning. Okay, what about these dogs? How are these two groups of dogs in this photo, how are they feeling? Stressed, potentially? Why do you, all of them stressed? What's the difference that you can see between those two groups of dogs? Yeah, so a group of them are relaxed, they're sleeping. Why are they relaxed and sleeping? What do the sleeping ones have that the other two do not have? They have a bed. So these are all dogs that are post-op. They've all had the same surgical experience, the same analgesic provision. The dogs that are relaxed and sleeping all have some level of bedding. There's a towel for the dogs at the front. I can get this to work. Towel for the dogs at the front. These are all on a towel, and then a mattress at the back. These two dogs are weight shifting. They're tense, hunched spinal posture, tucked into a corner. These dogs are demonstrating fairly classic signs of post-operative pain. So you can mitigate and manage a dog's pain experience simply by providing it with a bed. Doesn't have to be anything fancy. Could be cardboard, could be a rubber mat that you hose down and clean. Just needs to be somewhere comfortable. That mitigates the pain experience of those dogs. And then post-operative monitoring, really important. This is a dog 24 hours after surgery, low head carriage, stiff hind limb posture, tucked abdomen, low tail carriage. This is pain. So we tend to see this 24 to 48 hours post-operatively. So if we're seeing this, we should be re-evaluating maybe what we're doing in terms of surgical technique or post-operative analgesia provision. So we need to be able to recognize these problems. We need to understand why they occur in order to then be able to do something about them. So we can only improve what we recognize. And even then, even if we recognize the problem, we still might be limited in terms of changing it. So this is a human behavior change diagram. Our ability to change our behavior or to do something about it might be impacted by our knowledge, by the culture of the organization that we're in, or by peer pressure from our colleagues, or by our own personal ethics or attitudes. Maybe we don't think that pain is a problem. I don't know, hopefully you all do, but you know, everybody will have different viewpoints on what they think is most important within a program. Those things will lead to your intention to do something, to change your behavior, to make a difference. But even if you intend to improve things, that can still not happen because humans are creatures of habit, and the biggest predictor of your future behavior is what you have previously done. We really like to stick to our routines. We're very change averse, and recognizing that is one of the first steps in changing that. We also need access to resources and facilities, otherwise it's difficult for us to implement some of those changes. So all of those things will impact on our ability to take action to improve animal welfare. And recognizing that, we've tried to develop some tools that will help to support projects in addressing some of those key areas. So delivering effective and humane dog catch and neuter return programs is really difficult. It requires strategic planning. Had a great workshop on that yesterday. Intersectorial collaboration and information sharing. Self-reflection and ethical discussions. What do we do in those difficult situations? How do we manage euthanasia? How do we manage pregnant bitches? What do we do about puppies? What do we do about dogs with infectious diseases and we don't have the facilities to treat them? We need to have really clear guidelines on how we deal with those things within our own programs. We need to make sure we've got good staff training. We focus a lot on community education, but our own staff have to be the ambassadors for that. Development of standard operating procedures, and allocation of resources. And dog welfare, I think, has to be core to all catch, neuter, return programs. Everybody in this room has good intentions. I'm pretty sure from all of the vets and the animal handlers and the dog catchers that I've interacted with in the field, all of them are great people and they're all trying to do their best, often in quite difficult situations. But we can't assume that good intentions will lead to good welfare outcomes. So, an outline of the problems, what can we do about it? So I work at the University of Edinburgh. We've got pretty extensive experience of online and face-to-face education. I know that some of the people in this room have completed some of the MOOCs that we've developed on the Coursera platform. We also run a number of master's programs in animal welfare, animal behavior, and a variety of other subjects. But we also have quite a lot of practical veterinary and animal welfare experience. We are a veterinary teaching hospital. We do a lot of international work. We have long-term collaborations with dog population management organisations, shelters, and catch-neuter return programs. So humane catch-neuter return should be evidence-based. We've talked about a lot of these things, but we need to be able to measure things in order to be able to improve them. Benchmarking and data collection, as Andrew said this morning, is really important in order to allow us to then evaluate our practice. So one of the things that we've developed, and this is something that we would like to seek feedback from in terms of the community, is a welfare assessment app. Apps are really trendy at the moment. It's very simple. It's very easy to use. It's, I would say, a balance between scientific robustness and field practicality, because you can have the best science in the world, and if you can't use it in the field, then it becomes cumbersome and useless. So it's trying to be a broad tool, but it's very user-friendly, and what it allows is for you to collect data about dog welfare through 5 different stages of the CNR process. You can monitor the dog's experiences through each of those 5 stages, and it will flag up if there are particular indicators that are exceeding a threshold. And if those indicators are exceeding a threshold in terms of dogs not having access to resources, dogs showing particular behaviors that are problematic, or dog health problems arising that are problematic, then it will give you guidance on remedial steps that you can take action to improve that dog welfare experience. It's Apple and Android compatible. You can download the data for yourself for your own analysis. You can use it to support applications for funding, to demonstrate good practice in dog welfare, and just to demonstrate that actually you're concerned about dog welfare and that it's a priority for your organisation. The downside of it is obviously you need somebody to input that data. It does require somebody to watch the dogs to recognise those indicators, but there is in-app training given with that. And the other tool that we it's in development at the moment, we've just launched our first few videos, is a suite of video resources. So myself and my colleague Roxanne, who's also here, have been working on this over the recent months. We've been working with a large number of really great catch-neuter return programs all around the world to develop good practice guides to different aspects of catch-neuter return. They're how-to guides, which are particularly relevant to a field catch-neuter return context. You can have the best veterinary facilities in the world and have a great educational program. We have a whole bunch of videos that we use for training our veterinary students at Edinburgh. They're not relevant to a field veterinary situation where the resources are different and the application is different. So these videos are targeted very much towards that field clinic environment. They cover aspects of background information, strategic planning, and surveying, data collection. And there's also interviews with experts who have experience on the ground, who can share some of their direct experience and expertise. They're accessible to all, they're free to use, and if I can change this pointer back, I can just play you a short excerpt. So they contain video footage. I don't have any sound. It's okay. So they contain video footage that's been filmed over a range of some really nice catch-neuter return programs, just to demonstrate some of the challenges of field work, but also good practice and how you can overcome some of those challenges in the field. So I won't play that all the way through because there's no sound for it, but just so you can find those on the website, which is listed on that slide. I really think that everyone has something to offer when it comes to enhancing dog welfare. I think everyone in this room has some really great scientific knowledge, really great practical experience, really great experience in communication and collaboration. And I think these conferences are really useful for seeking each other out and finding those qualities. So I'd like to ask for feedback from all of you, if any of you use any of these tools. They are designed to help you with your projects in the community. If they're not working, I need to know. If they are working, brilliant, I can retire. But what we want to do is to try and support you guys to better promote and enhance dog welfare. I'd just like to gratefully acknowledge the various organisations who have been incredibly supportive in allowing us to collaborate with them. There's probably others on there that I haven't mentioned that I probably ought to. So I apologise if I've missed anyone out. And just some references for your information. So thank you very much.